Yes, greetings to you. Hopefully you're doing very well. I want to welcome you to HBMS TV Talking Health. And this is our first aid series part 4. You can always go back and check out series part 1, part 2, part 3. And here we come to you live with first aid series part 4. So my name is Robert Semwes, the director HBMS TV, and I want to send a vote of thanks to all our sponsors who make sure that these programs can keep running. And in our first aid series part 4, we are going to be briefly looking at the positioning of casualties in first aid. These programs are very good for medical students, but more importantly, they're also good for our community development and helping us survive very many accidents that we have in our communities. So when we talk about positioning of casualties, you need to know that the patient is taken care of in different positions, in different situations and conditions. And the commonly that I used, we have the recovery position, we have the prone position, we have the positioning in shock. In future, we'll be looking at shock on its own. Then we have what we call the Fowler's position, and more importantly, we also have what we call the dorsal recumbent position. So when we look at the recovery position, this is the most common position that is used in first aid. And here they tell us that a patient who is unconscious and is breathing and also has heartbeat should be taken care of in the recovery position. And what are the advantages, you who is out there? What is so important about the recovery position? We have advantages of what we call the recovery position. For example, it maintains an open airway, so it avoids suffocation of the patient. Then the other one, the tongue cannot fall back to the throat. More importantly, the recovery position helps the head and neck to remain extended. Then it also helps the vomiters or any fluid to drain freely. And these programs are sponsored by Michiana Institute of Nursing and Midwifery. So what are the steps for you to have the casualty in the recovery position? It is very important that you place the casualty in the prone position. That is when one is facing down. We will be looking at it. And you turn the head down to one side and you do not put any pillows. Then you pull up the leg and the arm on the side to which the head is facing. You need to pull up the chin so that the head remains hyperextended. Then stretch the other arm alongside the body. Loosen all clothing, especially the tight clothing. Remove dentures if any. These are the artificial teeth that people always have. Then you need to remove the bangles, watches, and bracelets. All this is very important. And this is how it is for you to, as you're seeing on your screen, that is how the recovery position is, with the leg bent to support the position so that somebody cannot roll over. Then the other hand under the chin to keep the mouth open for easy drainage, and the arm is bent to prevent the rolling over of the patient again. But you need to note that when it comes to the recovery position, it cannot be used when there are fractures of the upper or lower body. Then the other one, when the place of operation is confined. You find yourself you're operating in a very small area, you can't have a patient be in the recovery position. Then the other one is what we call the prone position. When we talk about the prone position, the patient is placed on his abdomen with the head turned to one side. Then a pillow is placed under the head and hands are kept on the sides of the body or beneath the head. This is commonly used in burns of the back. For example, somebody has burns of the back, you have them into that position and help them out. And then the other one is positioning in shock. In future, we will be looking at shock itself. we'll be checking it out to know what is shock, what causes, what are the signs and all that, simply because there are very many people out there who are suffering. So when it comes to this, you just need to lay the casualty on the back, you turn the head to one side, raise the legs with 2 pillows, then as this improves blood supply to the heart and then to the brain, even including the lungs. And you need to note that this should be avoided in fractured lower limbs unless they're well splinted or well taken care of. That is to do with positioning in shock. And the normal shock position, the most important treatment of shock is to maintain the blood flow to the body's vital organs. When we talk about the vital organs, that is the brain. You can talk about the heart and more important, the lungs. So your focus should be raising the legs and blood can flow to those important vital organs. Then the other one, we have what to call the Fowler's position. The patient is kept in sitting or semi-sitting position, either by use of 3 pillows or even 4. And more importantly, the degree matters. It can be at 30 to 45. At times, you need the patient to sit upright. That is 90 degrees and all that. And you need to note that most patients with difficulty in breathing, this is when we use this position, the Fowler's position. Now, the other position is what we call the dorsal recumbent position. The patient is kept on the back, the pillow is placed under the head, and the hands kept on both sides of the body. And you need to note that this type of position is mostly used in patients during examination. The other time in series part 3, we are looking at the general examination. So this position is used. Then the other one, do not put a pillow in cases of fractured spine and when also giving CPR, cardiopulmonary resuscitation. And this is how it is. At times, it is even called the dorsal recumbent or the spine position. I want to thank you very much for always following us at HBMS TV Talking Health, and more importantly, to all our sponsors who make sure that these programs can run. And these programs are very good for medical students out there. You can always check out from series 1, series 2, series 3, this is series 4. And very soon, we are going to be talking about cardiac arrest as series part 5. Thank you very much, and may God bless you. HBMS TV Talking Health.